Hello everyone, my name is Makleet Bakala. I am a nursing student at Emory University, and today with this video, we will delve into the realm of ABG interpretation. I know ABG at first hand, it can seem overwhelming and stressful, but I hope with this video, I will be able to make this concept way easier to understand. Okay, so let's begin by first discussing why we are even interpreting ABGs and what are ABGs. Okay, so ABG is a test that measures the blood level of oxygen, carbon dioxide, and acid base balance, pH, in the body. It is used to assess how well oxygen is being distributed and how well carbon dioxide is being removed. Arterial blood gas analysis is an essential part of diagnosis and management of patient oxygenation and acid-base balance. So the usefulness of this diagnostic test is dependent on our ability to correctly interpret our results. And here are our parameters. So the pH, the PaCO2, PaO2, and then HCO3, oxygen saturation. And one key factor in this test is that we are taking out blood from our artery and not our veins. And then one more thing I want to discuss before we go into practicing is talking about the parameters of ABG analysis. So let's talk about the ranges of the normal ranges of these parameters. Our first one is our pH. The normal range is 7.35, 7.45. So if it is less than 7.35, we know that it is acidosis, and then if it is greater than 7.45, we know that it is alkalosis. Okay, and then our partial pressure of carbon dioxide, our normal range is 35 to 45, and then it is a respiratory component if it is opposite direction to our pH. And then high partial pressure of carbon dioxide means that it is respiratory acidosis, while low partial pressure of carbon dioxide is respiratory alkalosis. And then our bicarbonate, the normal range is 21 to 28. Deviations from this range can indicate a metabolic acidosis or alkalosis. So a lower bicarbonate suggests metabolic acidosis, and while a higher bicarbonate suggests a metabolic alkalosis. And then let's look at this chart over here. Okay, as you can see in the first row, you can see pH, partial pressure of carbon dioxide, and then bicarbonate, and then the interpretation are seen in this box. Okay, and then if you can see the second row and third row, you can see that if the pH is high, we see alkalosis, either respiratory or metabolic. But the pH is high, we see alkalosis, and then the pH is low in the final two rows, we can see pH that is low is acidosis. Okay? And then, as we had discussed before, if the partial pressure of carbon dioxide is opposite to the pH, so as we can see in the second row, the partial pressure of carbon dioxide is opposite, and for that reason, we can see that it is a respiratory problem. Yeah, so, and then in the find the second to last row, we can see that the partial pressure for carbon dioxide is opposite to our pH, and then we can see that it is a respiratory problem. Yeah, okay. Now let's go on to discussing a few problems, and we will go through everything and make sure that we fully understand what these problems are talking about. So, question 1, practice example 1. So we have a pH of 7.61, and we have our normal ranges in the corner over here. So 7.61, it is higher, as you can see, higher than the range. So basically, we see that pH is high. So we don't know if it is going to be respiratory or metabolic, but either way, we know that it's going to be alkalosis, because why? Our pH is greater than the normal range, 7.35, 7.45. Yeah? So for that reason, we know that it is alkalosis. And then let's go on to looking at what the partial pressure of carbon dioxide is. It is 26, yeah? If it is 26, let's go on to see if it is in the range. Is it in the range? No, it is lower. So as we had discussed before, if you remember, I said that if the pH is opposite to the partial pressure of carbon dioxide, we can know that it is a respiratory problem. And for that reason, it is respiratory alkalosis. You know what? Let's see what our what our bicarb is next, and then so that we could make sure our answer is going to be respiratory alkalosis, because let's not forget what bicarb is, and let's not make a conclusion before looking at our bicarb. Okay, our bicarb is 25, so it is within defined limits. So basically, our answer was right. Okay, now let's keep going to our next question. Next question, let's do it very quick. Okay, 7.47, it's gonna be higher than the normal range, and then 44, if it is 44, it's gonna be within defined limits. Our answer is metabolic alkalosis. See how fast? Because we have this interpretation interpretation cheat sheets that we have to memorize. Of course, we cannot use this in our exams, but if you can see, it's very easy to memorize, because pH, the first two rows high, last two rows low, and then the first one for the partial pressure of carbon dioxide is opposite of pH, and then last to second row is high. The partial pressure of carbon dioxide is high, so it's very easy to memorize, and it's important that we really understand this chart so that we can do the questions as fast as we can do it right now using this cheat sheet. Okay, so again, in summary for this question, so 7.47 high, so pH is high. 44, the partial pressure of carbon dioxide is within defined limits, so the answer is metabolic alkalosis. And then, if you remember, let's not forget our bicarb, and let's look at it before we make a conclusion. So it's 35. So because it's 35, we can see that it is high. So, yep. And as you can see in the second row, when the pH is high and the bicarb is high, it is metabolic alkalosis. Okay, let's move on to our next question. Okay, question 3. So we have 7.32. So we can see that it is less than the normal range for the pH. So because we know that, let's go on. The answer is going to be between respiratory acidosis and metabolic acidosis, because as we can see, the pH is lower. Yeah. And then now let's look at the partial pressure of carbon dioxide. So we see that it is 36. So 36 is within the normal range. So if you can see the last row, when pH is low, and then when the partial pressure of carbon dioxide is within defined limits. And then, as you can see, 15 for the bicarb is low, so the answer is metabolic acidosis. See how this chart is it's magical because it works so well. But I have a question. Our final question is gonna be a question that is gonna be a little bit more tough, as this chart is not gonna be super helpful. So let's look at that question. I hope you understand this question, however. Okay, let's go on. So this is gonna make you probably stuck because this chart it's not gonna be super helpful. It is gonna be helpful, but it's gonna be confusing for a bit because it was confusing for me. So let's look at this. Okay, the pH is 7.29. Yeah, so which means it is less than the normal range. So the answer is gonna be either respiratory acidosis, metabolic acidosis. So look at the last two rows. And then let's look at the partial pressure of carbon dioxide, which is 30. So basically, as we have been used to getting questions where our pH is opposite from our partial pressure of carbon dioxide, or it's either the partial pressure is usually within defined limits for us from our previous questions. So however, in this question we see that our pH is low and also our carbon dioxide is also low. So when you're trying to use this chart, you're like, okay, so the pH is low, and then but when you look at the column for partial pressure of carbon dioxide, you see that there's no there's no wait, am I confused? Am I getting confused with this? Okay, so for some reason this chart did not help me answer this question. Let me see, let me look at it again. Okay, I am back. I had to look at this for at least 10 minutes to make sure I remember what I had studied. Okay, so basically, to answer this question, I decided not to use this chart, just use a new method. If if the pH is low and the partial pressure is low, don't use this. I decided to use a new method where I decide on so I had labeled this is acidosis for pH that is low, and then carbohydrates, no, bicarb, I keep saying bicarbohydrate. The bicarb is also low, so it is acidosis. So the two similar ones are acidosis, Yeah? So the answer is going to be acidosis. We know that. But now let's figure out if it is going to be respiratory or metabolic. And if you remember, I had told you about how a problem with bicarb is a metabolic problem. An issue related to bicarb is a metabolic. So the answer is metabolic acidosis. When you think of bicarb, just think metabolic, and then when you think of carbohydrates, um, no, not carbohydrate. When you think of um, piece, partial pressure of partial pressure of carbon dioxide. When you think of that, think of respiratory issue. Yeah. I hope you understand this question. Before I keep going to the next slide, let me just do an overall quick summary of this question. Yeah. So pH is low, so we go, and you don't have to be using the chart, but you can use it for 1 second and then decide to switching to the new method. So the pH is low. We know that it is either respiratory acidosis or metabolic acidosis, but we know it's going to be acidosis. And then the bicarb is low, so it's going to be acidosis, yeah? And then the partial pressure of carbon dioxide is low, so it's going to be alkalosis. And the two similar ones are acidosis between bicarb and pH, and because bicarb is low, we know that it is going to be a metabolic problem, and so this is going to be a metabolic acidosis. In the next slide, I have a big cheat sheet on understanding everything about ABG interpretation. So in the corner, we have the normal range of ABG key values, pH, carbon dioxide, and bicarb. And then over here, there's this mnemonic. One of my professors gave me. It is Rome, a respiratory opposite, metabolic equal. So why is it opposite for respiratory? So it is because when the bicarb, no, not the bicarb, when the carbon dioxide is high, the pH is low. So which is opposite. And then as you can see, the carbon dioxide is high, pH is low, it's going to be an acidosis, respiratory acidosis. And then when the carbon dioxide is low and the pH is high, it is going to be respiratory alkalosis. And then same goes for metabolic equal, where the bicarb is low and the pH is low. And then so if it is low, it is gonna be metabolic acidosis. And then if it is high, it's gonna be metabolic alkalosis. And one more thing about ABG interpretation that we haven't discussed is there's this new there's this thing called compensation. So this is where we look at the pH, and if the pH is normal, so within the normal range, if it is fully compensated, and then if it is uncompensated, it means that the carbon dioxide or the bicarb are in range, and then if it is partially compensated, it means that the carbon dioxide and bicarb are both out of range, yeah? So which means For example, if the pH is 7.30 and the carbon dioxide is 50, and then bicarb is 30, the bicarb is partially attempting to compensate the respiratory acidosis issue. And then the pH level is acidic and the bicarb is basic. So we see the effort from the bicarb here. Okay, and over here in the other side of the chart, we can see the meaning of what is the meaning of metabolic acidosis, metabolic alkalosis. All of these are disorders that individuals may have. And here are the signs and symptoms for all and potential treatment for all as well. Okay. Okay, now let's go on to our next slide. Again, I just wanted to highlight this aspect of ABG interpretation, a mnemonic. It's an old one that I always write in the corner of my notebooks to remember. This helps me a little bit in understanding the interpretation. Okay. And then before we go, I just want to say thank you so much for listening to this recording, because I'm learning as well, and we're all learning together. And I know this is a little bit complicated, especially if you haven't taken ABG course yet. So hopefully this video will be able to help you out in understanding this concept a little bit better. And good luck in your nursing career. Thank you.